Well, new at 3, June is Oral Health Month, and Dr. Mitchell Josephs, he is live right now to talk to us about the importance of dental appointments. And Dr. Joseph, thank you so much for joining us.
Thank you.
So the pandemic, I can imagine, saw a lot of hesitancy, but now with more vaccines out there, why do you think that people are still so hesitant to go to the dentist?
Well, I think people are still a little paranoid about contamination from aerosols from dental offices. I think they're still worried about that. You know, the media talks about breakthrough infections and being around people that they may think have not been vaccinated. So I think it's the same fears that people had during the shutdown during 2020, that they're afraid that they're going to catch something in the dental office, which has already been proven that nobody has been reported as getting an infection traced to a dental office. There's certain precautions that we're able to take, too, that we've been taking since last year.
All right. Well, do you have any tips then for those who are dealing with a dental phobia?
Yeah, if your dental phobia is based on you're afraid of cross-contamination or infection of COVID at a dental office, go to a dental office that has been equipped with extra oral suction units. These look like almost like a vacuum cleaner with a funnel on the end that we place next to the mouth. So when we're doing any procedures where we're using a drill, let's say, that sprays water and aerosol, or we're doing implant surgery where we're using drills that cut bone and create an aerosol into the air, using an extra oral suction sucks up about 99.9% of all aerosols.
And Dr. Josephs, you know, again, we are talking about Oral Health Month and the importance of seeking, just going to the dentist. I mean, you're supposed to do it like twice a year, right? Just tell us a little bit about how important it is to not skip those much needed appointments.
Yeah, well, if I could say a positive thing about the COVID pandemic is we certainly learned that delaying dental work, even just by 2 months, was catastrophically expensive for patients. An example is if you had a cavity, let's say in February 2020, and then 2 months dental offices and surgical specialties were shut down. So you lost 2 months of getting that cavity fixed. Then once the doctor's offices reopened, you were scared about going back, so you didn't get to that cavity maybe till late in the summer, early fall of 2020. Well, the $350 cavity became a $5,000 extraction and dental implant and crown.
You definitely don't want to ignore those. Dr. Mitchell Joseph, thank you so much for joining us today.
My pleasure. Thank you.